right, everybody, we're back with our first Cabral HouseCall of the weekend. Can't wait to get into today's show. Love seeing what everyone is asking from the community. Now, of course, I know many people are going through some struggles right now and some hardships. So I also am very sensitive to the fact that we're working with people, we're talking with people that are in a tough spot right now. But I do hope that after listening to the answers that I may provide, that it gives you some hope to understand that there is always a root cause, and we're going to find it. We really are. And since we're going to find it, we can have hope that healing is going to take place. So let's get right into it. Again, I have to share with you always the disclaimer, can't provide any medical advice, medical treatment plans, medical cures, medical diagnosis. My job is to help share the underlying root cause, how to get there, and then to rebalance the body. All right, so I just opened up today's document. I do not know today's show number, so let me give it to you right now. It will be at stephencabral.com/3186 if you want to follow along with the questions. All right, let's dive into the first question. It says it's from Anonymous, and Anonymous says, hello, I'm a 36-year-old woman who eats mostly a clean plant-based diet, but still has fibromyalgia and inflammation in the body. My periods are regular and not strong, but they start with spotting a few days before the painful first day of the period. What can I do to stop it being so painful? Also, last month I had some spotting and bleeding 4 days around the time of ovulation. Is that normal? What does it mean? How do I get my body back in balance? Okay, so happy to help here. What a lot of people would say, just get your hormones run. And I'm not disagreeing with it. I mean, I want to make sure I know where you're at, especially a days 19, 20, or 21 in the luteal phase of your cycle. So you would run the stress mood and metabolism then, and we would look at cortisol levels, but we would also look at insulin levels, hemoglobin A1C, and vitamin D levels. Now, there's more in that lab. It looks at thyroid, etc. But I want to make sure that we're not dealing with multiple hormonal factors. Maybe there's high androgens, like high testosterone. Maybe there's high cortisol at night. Maybe there's also low thyroid as well as high insulin levels. So we might have a lot to work on that would be dramatically beneficial to you. If we can better balance your blood sugar, better balance your vitamin D levels, which might be low, we can work on a lot of these things. I would also want to run your inflammation levels, so your omega-6 to omega-3s. I'd want to look at other things that are causing the inflammation for your body to be out of balance, right? Because if you're mostly eating a clean diet, and I don't know if you're moving your body, like I don't know all the different things that are going on, but what we would do is we would personalize a plan more for you. So in an ideal world, everybody would run the Big 5 labs. So the Big 5 labs, stephencabral.com/BIG, the number 5. You can check them out. You can run them with Equilife, or you can run them with an integrative health practitioner level 2, or your favorite doctor. And that's totally fine. But we need to find out what's the underlying root cause. Now, again, if you're just coming in saying, I have fibromyalgia, inflammation, maybe we look at using seed cycling. You can look at my previous podcast on that. You can always ask at cabralsupportgroup.com. We can find any podcast you may need. You might use a product called Estrogen Balance. We would use omega-3 support. We might use extra magnesium at night. These are all things that we could start with, but in my world, I like to find out what your deficiencies are and what your toxicities are. I want to decrease those toxicities, and I want to increase your deficiencies. All right, I want to improve on your deficiencies. Okay, hopefully that was helpful, Anonymous. Laura is up next. Hi, Dr. C. I know you say nutritional yeast is a problem because its molecules are similar to MSG, or that's how the body perceives it. But someone told me the same happens with tomatoes and mushrooms. They say nutritional yeast is a great source of B12 and folic acid. It does naturally occurring MSG, but so do tomatoes and mushrooms. So is it the same? Is the naturally occurring MSG as bad as actual MSG? Should we avoid tomatoes and mushrooms as well? Thank you for the clarification. Great question. And whoever told you that knows what they're talking about. No doubt about it. And so, props to them, like without a doubt. That is true. Now, there's some nuances, of course. First and foremost, I did not necessarily say that nutritional yeast is a dangerous and terrible product. I said for people who have anxiety, brain fog, learning disabilities in childhood, throw tantrums in childhood, get more irritable, nutritional yeast is not a good product for them. Obviously, MSG isn't either, right? Monosodium glutamate. Well, nutritional yeast contains glutamic acid, right? And so part of that basically is MSG, glutamate, right? That's what we're looking at. Very easy conversion necessarily in the body. So whoever you talk to brings up a good point. Tomatoes and mushrooms also contain glutamic acid, especially really ripe tomatoes. So what's the difference? Well, the difference is, and it's nuanced, but it's still a difference, is that nutritional yeast has glutamate or glutamic acid in its free form. All right, so more in its free form. So what that means is, well, first of all, that's why it tastes, nutritional yeast tastes more like MSG, like umami, right? Because it's in its free form, so it has that almost sweet-based flavor. Whereas tomatoes and mushrooms, the glutamic acid is actually bound and tied up more with proteins, which means the absorption is different than that of nutritional yeast. Now, having said that, if someone also has the anxiety, the brain fog, the irritability, the learning-based issues, etc., and they get the same issues with mushrooms or tomatoes, yeah, they should eliminate those as well. So, yeah, I hope you know, listening to the show, I don't speak in absolutes because it's all about bioindividuality. So if someone feels great using nutritional yeast, okay, not totally against it. There is B12. There is folic acid. Are they in their best form possible for the body to absorb? No. But that doesn't mean that it's necessarily a negative. I just wouldn't go overboard as nutritional yeast as a wild superfood. That's all. So hopefully that was helpful. I think that your friend is absolutely warranted in bringing that to your attention, but hopefully my answer was helpful as well. All right, Anne's up next. Hi, Dr. Cabral. Thank you for all you do for the community. I have a question about both heart rate variability and VO2 max. Barring go to a specialist to get tested, what are the best and most accurate tools to measure each? Thank you again, as always, for all you do. Thank you, Anne. I appreciate you. Okay, so heart rate variability, absolute best way to test it is with anything with a chest strap monitor. Because after that, the further you get away from your heart, the weaker the signal. And I've looked at this over years and actually worked and on the advisory board of health tech companies that measure this. So I know for sure that happens to be the case. So let's go for an example. When I used the Hanu device, I got my true measurement using a chest strap, okay, my true HRV. Then when I moved to the forearm-based strap, I probably lost, I can give you the exact measurement, I lost about 20 to 25% from what it was at my chest. Then with a Whoop strap or Apple Watch, I will get about 30% to almost 40% less signal. So 40% weaker than my true HRV. Then when I go to the Oura Ring, I'll get about 40 to 50% less. So it's remarkable. It is less. There's no doubt about that. Now, here's the thing though. It does not really matter what your HRV is. It doesn't. Now, if it's single digits like mine used to be, that's obviously, it's no matter where you're at, that's a really struggling body. But it can be fixed, just like I fixed mine. It doesn't happen overnight, but I fixed mine. I really did. And I greatly improved it over the past 3 years, like greatly improved it. And I'm now in my mid to going into later 40s. And so all of these things are fixable even, as you get older. It is important to understand that. Okay. So for heart rate, I actually did a show on this, Apple versus Oura, and they both have, Apple, Oura, and Whoop. My very favorite tool is without a doubt the Oura Ring. No doubt about it. I'm not sponsored by them. I don't make any money recommending them. Just the absolute best all around for sleep and recovery and all of those things. The Whoop strap will give you a better heart rate variability. No doubt about it. I agree with that. And yeah, so that's that. Okay. VO2 max. I teach all of this in depth. By the way, if this is interesting to you, I teach all of this in depth in High Performance Health. That's open to the public. You can just go to highperformancehealth.org. It's an entire course or it's a certification for if you want to become a high performance health coach. All of this is taught in depth on everything cutting edge, anti-aging and longevity. So I can't recommend checking that out enough. Now, I have specific podcasts on the Cooper test, and I have one on, I'm trying to think of the other one. I have the Harvard step test. I have that one. And then I have the Rockport walk test, I believe, as well. So all of these are definitely at highperformancehealth.org. And if you go to stephencabral.com/podcast, type in 12-minute run or Cooper test. It's a great one. If you can't run for 12 minutes, you're not able to do that one, but there's also a step test. There's a walk test as well. So all of those are helpful. Now, if you use a Whoop or you use a Oura Ring, it will also estimate your VO2. So will the Garmin watch. The Garmin is actually a great tracker too. So the Garmin watch will look at that too. So I like health tech. I really do. And I'm a big fan of it. Okay. So hopefully that was helpful. And Charlotte's up next. Hi, Dr. Rawl. I'm currently trying to conceive and I'm working with a naturopath and integrative doctor to prepare and keep Hashimoto stable. We completed a stool test, which was positive for H. pylori, staph, and high inflammation of calprotectin of 376. For anybody who wants to know what that means, it's basically an inflammatory number, and it does show high levels of inflammation for this individual. So it's mostly coming from something like what doctors would diagnose as an IBS, IBD, etc., but it doesn't tell you what it is. It doesn't say Crohn's, colitis, etc. Okay, 3 weeks prior to doing the stool test, I traveled to Thailand where I ate outside of my usual gluten and dairy-free diet and also had stomach upset and diarrhea for 4 days. I usually have no gut issues. Do you think the upset travel could be from the H. pylori and staph to raise that marker? Naturopaths want referral for colonoscopy ASAP, as could be driving thyroid and persistent antibodies of 300. Doctor and I are reluctant as no prior gut issues and is invasive. Completed 4-month gut protocol to remove pathogens. Now working on inflammation. What's next? Okay. So, the hard part is this, is that when you're under the care of another doctor or doctors, I don't want to go against their advice because they have your whole health history. I don't know that much about you. I don't have any of your lab tests. So I don't want to go against any of their guidance. So that's the thing, is that I don't actually recommend people work with like 4 or 5 doctors at the same time. You can have a medical doctor and then you can have an integrative health practitioner, but I just multiple people telling you different things is not always in your best benefit. So what I would have done is I said, okay, we've got some H. pylori, we have some staph, we've got some inflammation. I would do something like the CBO protocol and CBO finisher. CBO protocol is 12 weeks, CBO finisher 4 to 12 weeks. Easy, right? So it's done. And the CBO finisher is literally just a healthy gut support and a probiotic. So no problem at all. Then let's just say 4 months, 5 months later from when you started the protocols, like maybe where you're at right now, I would retest. And I would make sure that these levels are like, there's no more H. pylori and there's no more inflammation. That's what I would do. And then if you want to, you can certainly do a colonoscopy. It's not like you can't. You could certainly do that. But you can also, if you're worried about other issues like cancer or whatever, you could certainly run a fit test at home. And so there are a lot of things that you could do. I'm not going to say not to do a colonoscopy. You could certainly follow your doctor's advice and take that colonoscopy if you choose to. So whatever works for you, but certainly part of Hashimoto's is gut health, without a doubt, stress, heavy metals, imbalanced, improper sleep, all of those things. So I would definitely look at that. All right, let's do one more question. It's from Allison. Allison says, hi, Dr. Rawl. I searched your podcast archives. It didn't see anything on the topic of bone spurs. My dad has some in his shoulder, and they say the only way to deal with his limited range of motion is surgery. I also have them under my kneecaps, which has created a lot of mobility issues. And the surgeon told me he could operate and clean out the surface under the kneecaps, but there would be no guarantee it would work or help. Why do bone spurs occur? And is there any way to get rid of them naturally? I'd also love to know how to prevent them from reforming. Okay, so as always, there's a genetic component to these things. However, it doesn't mean necessarily that you're going to get them. So what are the most common reasons for bone spurs? The most common reasons are trauma to the joint. So it can be something like osteoarthritis, where you've worn away a lot of the anticular cartilage. And so what's happening is now it's bone on bone, and that's creating inflammation and creating a bone spur, bone bump, basically. There can be poor biomechanical posture, and over time, again, it leads to bone on bone or inflammation, because inflammation alone can create that bone spur. Inflammatory issues in the body, inflammatory issues of the joints could create bone spurs. That's certainly one. And then, as I said before, actual trauma or injury to the joint, trauma to the shoulder injury can create bone spurs in the future. So I definitely understand, where you're coming from, and there are things to do. So I always say exhaust physical therapy first, because you want to improve your overall mobility. But your mobility can be shortened without bone spurs, like without a doubt. So work on mobility with a physical therapist or really good personal trainer or active release, individual like chiropractor. And that could be very helpful. Another one is natural anti-inflammatories. 2 grams of omega-3s a day, omega-3 fish oil. Something like Inflamasoothe would be a great one. Proteolytic enzymes. Use natural anti-inflammatories first. See if that's helpful. And then after that, work on posture, like all of that's important. Work on running form if you're running or weightlifting. And then as a last resort, yes, you always do have surgery because they can go in and shave off those bone spurs. But as your doctor said, there is no guarantee that it ultimately works. It does for many people. I'm not going to lie and say that it doesn't, but it is something to look at. There is some more innovative ways that at least are worth looking into potentially. One is ultrasound therapy. So actually hitting the bone spurs with ultrasound could be potentially something worth looking into since there's really not a lot of potential harm from that. But again, I'm not providing medical advice, medical treatments, medical cures, medical diagnosis. There's also shock wave therapy as well, sometimes called ESWT. And this is sending almost like an ultrasound, but a shock wave to break down these bone spurs. I see it used more in plantar fasciitis where there's bone spurs of the feet, but certainly it might be worth looking into in other areas. Not my expertise, but I wanted to at least bring that to your attention. All right, hopefully these Q&As were helpful. I will be back tomorrow answering another 5 to 6 of our community's questions. And of course, if you have questions, you want same-day answers, head on over to cabralsupportgroup.com, drop your question in there, and we are always happy to help. Take care, everybody. I'll talk with you soon. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.